I'm Dr. Dai Chung, Chief Medical Officer of the Joint Pediatric Enterprise between UT Southwestern and Children's Health. In these videos, I'll sit down with various physicians to shine a light on the clinical excellence, innovation, and medical advancements that are happening across our enterprise.
What specific things that we offer that sets us apart?
We are completely pediatric. You need to make the investments in the programs and in the resources that children and their families really need. Children's has been willing to do that. We have just established in the last couple of years, and I'm proud of it, the first 22Q team in Texas. It's a team approach. These children have a specific genetic condition. You have to have all of those people in the game.
One of the things that I think that we really are national, if not international leaders in it, is in the management of children whose hearts have failed. Sometimes people need heart transplants much more quickly than one will be available for them. And then we use something called mechanical circulatory support. And so we have really led the way in modifying those pumps and creating some very imaginative reconstructions to allow those pumps or other pumps to function. There are only a few other places in the country that have the volume that we have. It gives us the opportunity to develop an experience and an expertise that positions us to improve the overall state of the art.
We purchased a robot for some of the epilepsy procedures I do. And so using the robot, I can stereotactically put multiple depth electrodes into multiple areas of the brain in order to isolate a foci that is responsible for a patient's seizures. But then you've got all these patients that we think it's here, it might be here. Is it the whole thing? Is this going to be palliative and not resective? And those are the ones that we weren't able to treat before. Those are the ones that now all this new energy and all this new concepts and innovation is going into.
I would say like one of the most advanced things that we do is there's a condition called esophageal atresia, in which baby's esophagus is not connected and you have to put it back together. Across the nation, I would say that we're in the top tier of minimally invasive surgery in pediatrics at this point. What we like to tell our trainees is that when they get a call as their first call for a consultation, the answer is yes. Just we'll figure out who needs to do what, but just the answer is yes.
Putting our knowledge and our expertise together to be able to care for really just the most complex conditions that could possibly exist in pediatric urology, I think that really sets us apart from other hospitals. So I am building a program that is focused on treating the most complex patients with voiding dysfunction, so a complex voiding dysfunction program, and pooling together the resources from nutrition, from gastroenterology, from psychology together into one space to be able to offer care for these children in a comprehensive way, including things that are really advanced techniques such as placing an interstim neurostimulator device, as well as just advanced diagnostic measures.
I get a lot of calls from other hospitals, not only in the United States, but even in other countries, where they're struggling with these challenging cases, and they tell me about all the different minor procedures they did and all the MRIs they obtained, and asking why the patient's still not getting better. And so the procedure that we've evolved to perform here, which has been developed over a couple of decades and all the experience of all the kids with osteomyelitis we've treated, is extremely aggressive debridement of the cancellous bone in each of the foci of the infection. I have been asked several times to be visiting professor to talk about this program.
Really amazing feat. I mean, we truly have one of the world's leading authority in our own campus.